Spastic Society of Gurgaon. Spastic Society of Gurgaon covers within its scope the programs on occupational therapy, counseling, vocational training, and psychotherapy of the children with autism, cerebral palsy, intellectual disability, and multiple disabilities in Haryana, India. It is India's first non-profit disability sector organization, which was awarded ISO certification by United Kingdom Accreditation Service, United Registrar of Systems for quality of services rendered by it. It also works in the field of imparting counseling and psychotherapy to the parents and guardians of the disabled children. Mass camps are conducted for welfare of children with disabilities. Multiple single-window services like assistance in issuance of disability certificates, Naramaya cashless insurance cards, medical checkups, distribution of medicines, and medical aids are rendered to the disabled in such camps. Being sponsored by Haryana government, it undertakes disability audits of organizations for assessing accessibility compliance by them. It was founded by Rajesh Bola along with some eminent doctors and social workers drawn from different super specialty fields. Rajesh Bola is working for the cause of persons with disabilities since 1985. He completed his post-graduation in English literature with linguistics from Punjab University, Chandigarh. Later, he completed his PhD in English literature. He is an Indian spiritual writer known for his weekly spiritual column in Friday Gurgaon. Also contributes articles to Hindustan Times Inner Voice and blogs to the Speaking Tree of the Times of India. History. Spastic Society of Gurgaon aims to address certain questions related to welfare of spastic children of Gurgaon, NCR and Haryana. People from various walks of life have joined hands to make efforts to arrange for long-term care of such children, and also to help their parents live life fully, purposefully, and contentedly by bringing them closer to each other, by creating coordination between various agencies, social workers, professionals, and infrastructure providers. Efforts are also being initiated to make environment of Gurgaon, the Millennium City of India, more spastic-friendly. Activities. Services being rendered by ESOG through two separate delivery channels are the Center for Special Children and the Center for Physiotherapy for Senior Citizens. All the services rendered at the Center for Special Children are free of cost. It was established to expedite provision of disability certificates and as a single-window service to assist disabled persons in obtaining benefits from the state and central governments. ESOG has been appointed as NGO member of Local Level Committee LLC Gurgaon by Ministry of Social Justice and Empowerment, Government of India. As part of rehabilitation, the specially challenged persons are kept in the mainstream and looked after for their emotional needs as well. Music and entertainment is part of rehab. Many noted persons from music, art, craft, and drama fields often meet such children during interactive sessions with guardians of such children. Ilagakarn is one of the young Bharatanatyam exponents who performed at Spastic Society of Gurgaon. Managing disability. Each person with cerebral palsy has unique strengths and areas of difficulty. Most children with cerebral palsy need ongoing help with daily care to long-term care, while mastering specific skills is an important focus of treatment on day-to-day basis. The ultimate goal is to help children grow into adulthood with as much independence as possible. Depending on their physical and intellectual abilities, adults need help finding attendants to care for them, a place to live, a job, and a way to get to their place of employment. For parents to accept a child's disabilities and come to grips with the extent of their caregiving responsibilities will take time and support from different professionals. ESOG is coordinating with these professionals and encourages partnerships between parents and these professionals. Although medical specialists may be the experts, it is parents who know their children best. ESOG makes the efforts to integrate these efforts aimed at making the life of the spastic child livable and comfortable to the best possible extent. Government of India has been very helpful in giving shape to things for welfare of poor cerebral palsy children by jointly organizing disability camps for single-window delivery of many facilities, which included medical. Such camps are organized with support of local deputy commissioner and chief medical officer of the concerned district. Spreading awareness about risk factors. Despite advancements made in the field of medicine and allied fields, the exact cause of cerebral palsy remains unclear. About 50% of all children who develop cerebral palsy were born prematurely. Premature infants are at higher risk because their organs are not yet fully developed, increasing the risk of asphyxia and other injury to the brain. Some other causes of cerebral palsy are asphyxia, hypoxia of the brain, birth trauma, premature birth, multiple birth, and certain infections in the mother during and before birth. Other major cause of cerebral palsy after birth in developing nations like India is medical neglect. Many signboards and other visual materials are displayed at prominent places for spreading awareness amongst people about precautions to be taken at prenatal, at time of delivery, and at postnatal levels to avoid incidents of deformities. Symptom management. Cerebral palsy was first identified by English surgeon William Little in 1860, who raised the possibility of asphyxia during birth as a chief cause of the disorder. In 1897, Sigmund Freud, the famous psychoanalyst, suggested that a difficult birth was not the cause but only a symptom of other effects on fetal development. All types of cerebral palsy are characterized by abnormal muscle tone, posture, reflexes, motor development, and coordination. The main symptoms are problem with balance, involuntary movements, and scissor making. On the whole, cerebral palsy symptoms are very diverse and different in each case of cerebral palsy. The effects of cerebral palsy fall on a continuum of motor dysfunction which makes coordinated movement almost impossible. In case of delayed milestones, the parents need to approach for medical guidance and complete medical diagnosis and analysis. Non-invasive rehabilitation procedures are the only methods for enabling persons with cerebral palsy to lead their lives to the best possible ways. ESOG is spreading this message through their medical specialists in the field to major hospitals for early diagnosis. Inclusive care, welfare for the disabled. A local level committee LLC has been set up by the Ministry of Social Justice and Empowerment in every district in India to monitor and govern issues related to disability. An LLC constituting the Deputy Commissioner of the district and an NGO working in the field of disability looks after matters related to welfare, rehabilitation, medical care, special education, and legal guardianship of persons with disabilities. In Gurgaon, the LLC constitutes the Deputy Commissioner and the Spastic Society of Gurgaon. Some important decisions have recently been taken for the welfare of persons with disabilities, particularly those with mental disabilities, in Gurgaon, in an LLC meeting attended by Deputy Commissioner Shakar Vidyarathi, Dr. Rajesh Bolla, President, Spastic Society of Gurgaon, and City Magistrate MS. Ekta Chopra. 1. A basic criterion for the issuance of guardianship certificates has been relaxed. Now, even those parents of disabled children who have migrated to Gurgaon from other cities and who have stayed in Gurgaon for less than 10 years will be considered for issuance of guardianship certificates, provided the applicants produce the address and identity proofs to the satisfaction of the competent authorities. 2. A disability camp will shortly be organized at the premises of the Spastic Society of Gurgaon Old Age Home, Sector 4, for the delivery of single-window services to the disabled. Rajesh Bolla will coordinate for the same with the Chief Medical Officer, Primary Health Officer, and the Disability Liaison Officer at the Civil Hospital. 3. All the major hospitals of Gurgaon have been advised to display an essential signboard as per a specified content and design which would help spread awareness on how to prevent disability. The signboard would be positioned near the gynecological departments and neonatal nurseries. A lack of knowledge on the part of women at the stages of pregnancy, delivery, and child rearing contributes significantly to the problem of disability. Such signboards have already been displayed at the Civil Hospital, bus stand, and Spastic Society of Gurgaon. 4. A camp for measles vaccination of the disabled and for needy children will be organized at the Spastic Society of Gurgaon premises before this month end.